Hello and welcome. Today we're diving deep into a common yet often excruciatingly painful condition, ureteral calculi, more commonly known as kidney stones stuck in the ureter. Join us as we explore what causes these stones, how they impact your body, and what you can do to prevent or treat them. So, what exactly causes these pesky stones to form in the first place? Ureteral calculi are typically the result of a complex interplay of factors that lead to the supersaturation of minerals in the urine. This means there's simply too much of a certain substance, like calcium, oxalate, or uric acid, for the urine to keep dissolved. When the urine becomes oversaturated, these minerals begin to crystallize. Reduced urine volume, whether from dehydration or medical conditions, further concentrates these substances, increasing the likelihood of crystal formation. Dietary factors, such as high intake of sodium, animal protein, and oxalate-rich foods, can also contribute. Certain medical conditions like hyperparathyroidism, gout, and urinary tract infections can also increase your risk. And sometimes, genetics play a role, making some individuals more susceptible than others. Now, let's explore what happens inside your body when a kidney stone gets lodged in the ureter. Once a stone forms in the kidney, it may travel down the ureter, the narrow tube connecting the kidney to the bladder. If the stone is small enough, it may pass through without much trouble. However, larger stones can get stuck, causing a blockage. This blockage leads to a build-up of urine in the kidney, a condition called hydronephrosis. The pressure from the backed-up urine causes significant distension of the ureter and renal capsule, triggering the intense pain we associate with kidney stones. The ureter also responds by spasming, trying to push the stone through, which contributes further to the pain. In addition, the obstruction can cause inflammation and irritation of the ureteral lining. Ureteral calculi are a widespread health concern, affecting millions of people worldwide. The prevalence varies geographically and depends on factors like diet, climate, and lifestyle. Men are generally more likely to develop kidney stones than women. Although the incidence in women has been increasing in recent years, the peak age of onset is typically between 30 and 50 years old. Certain ethnicities, such as Caucasians, have a higher prevalence. It's important to remember that anyone can develop ureteral calculi, making understanding the risk factors and preventive measures crucial for overall health. Okay, let's talk about what you might experience if you have a kidney stone stuck in your ureter. The hallmark symptom is often described as one of the worst pains imaginable: a renal colic. This intense, sharp pain typically starts in the flank, the area between your ribs and hip, and may radiate down to the groin and lower abdomen. The pain usually comes in waves as the ureter spasms to try to move the stone. Other symptoms can include nausea, vomited in the urine, frequent urination, and a burning sensation during urination. In some cases, if the stone is associated with a urinary tract infection, you might also experience fever and chills. It's important to seek medical attention immediately if you suspect you have a kidney stone, especially if you have a fever, as this could indicate a serious infection. So, how do doctors determine if you have ureteral calculi? The diagnostic process typically starts with a thorough medical history and physical examination. Based on your symptoms, the doctor may order several tests. A urinalysis can detect blood in the urine and signs of infection. Imaging studies are crucial for confirming the presence, size, and location of the stone. A non-contrast spiral CT scan is often the preferred method because it's accurate and doesn't require any special preparation. An X-ray of the kidneys, ureters, and bladders (UB) can also be used, although it's not as sensitive as a CT scan. In pregnant women, ultrasound may be used to avoid radiation exposure. Once the diagnosis is confirmed, the doctor can then determine the best course of treatment. While we primarily talk about kidney stones or ureteral calculi, it's important to understand that stones are not all created equal. The composition of the stone is a key factor in determining treatment and prevention strategies. The most common type is calcium oxalate, followed by calcium phosphate. Other types include uric acid stones, struvite stones, often associated with urinary tract infections, and cystine stones, which are rare and related to a genetic disorder. Understanding the specific type of stone you have can help your doctor tailor your treatment plan and recommend specific dietary or lifestyle changes to prevent future occurrences. Fortunately, there are several treatment options available for ureteral calculi. The approach depends on factors such as the size and location of the stone, the severity of your symptoms, and the presence of any complications like infection. Small stones, typically less than 5 millimeters, may pass on their own with conservative management. This involves pain medication to relieve the discomfort, alpha blockers to relax the ureteral muscles, and plenty of fluids to help flush out the stone. Larger stones may require more intervention, Extracorporeal shock wave litropsy (ES velo) uses shock waves to break the stone into smaller fragments that can then be passed. Ureteroscopy involves inserting a small scope through the urethra and bladder into the ureter to visualize and remove the stone or break it up with a laser. In rare cases, open surgery may be necessary. Regardless of the approach, the goal is to relieve the obstruction, alleviate pain, and prevent kidney damage. Prevention is key when it comes to ureteral calculi. Simple lifestyle changes can significantly reduce your risk. Drinking plenty of fluids, especially water, is crucial to dilute urine and prevent crystal formation. Aim for at least 2 to 3 liters of water per day, unless your doctor advises otherwise. Modifying your diet can also help. Reducing your intake of sodium, animal protein, and oxalate, rich foods like spinach, rhubarb, and nuts can be beneficial. Depending on the type of stone you're prone to, your doctor may recommend specific dietary adjustments or even medications to help prevent stone formation. Regular exercise and maintaining a healthy weight are also important for overall health and can reduce your risk of developing kidney stones. The prognosis for individuals with ureteral calculi is generally good. Most stones will eventually pass, either on their own or with medical intervention. However, recurrence is common, with many individuals experiencing multiple episodes throughout their lives. Recent research has focused on developing more effective and less invasive treatment options, as well as identifying new risk factors and preventive strategies. For example, researchers are exploring the role of the gut microbiome in stone formation and investigating new medications to reduce calcium or oxalate levels in the urine. Ongoing research promises to further improve the management and prevention of ureteral calculi in the future.